Hi, I'm here with Jessica Curtis and Gwyn Chi Win. We're at Community Catalyst in Boston. Thank you all so much for having me.
It's a pleasure. Thank you.
I asked for you all to join me to talk about medical debt and balance billing because you all have some expertise in this area. Can one of you say a little bit about what Community Catalyst does?
Sure. So Community Catalyst is a national healthcare consumer advocacy organization, which is a lot of words, a lot of nouns all thrown together. But essentially, we exist because all of the other players in the healthcare marketplace, providers, pharmaceutical companies, insurance companies, have their representatives in Washington and at state capitals. And we felt, our founders felt 20 years ago, we really needed to have patients have a voice in those same discussions. So we support a lot of different pieces of legislation and regulation that affect how patients and families experience the healthcare system. And our goal is to help support them make that system more responsible to what they need.
You all know that we did a webinar already and we used some of your colleagues in talking about how considerations when you're purchasing health insurance and if your health insurance isn't doing what you need it to do.
Mm-hmm.
But we weren't able to address all of the issues that can come up. And when we're talking about people with mental health conditions, some of the things that happen frequently are that they might be hospitalized on an emergency basis, and there are certainly appealable issues involved in their stays and their termination of stay. But one of the concerns that we have had is about what happens when you go to a hospital and you receive care from someone and it turns out that either they're not in your network or they bill you for what is left over that the insurance doesn't pay. Are there tips for avoiding those kinds of situations?
So I agree with you that the balance billing, supply billing that you mentioned is a big concern for people. It doesn't matter what kind of insurance you have. Like people with underinsurance or good insurance, sometimes they still get supply balance billing. So it's happened is because, like for example, you go to emergency room. The emergency room is in the in-network hospital, for example, but the surgeon, the ER doctor is out network. And this is emergency situation, so you don't really have a chance to check to see whether that ER doctor is in network or not. So basically, at the end of the day, you get a bill from that doctor and say, okay, you owe me because you go out network. So that is one situation. Another situation is that you schedule a surgery with an in-network surgeon at an in-network hospital. So the surgery, you have a whole team of people helping with the surgery. The radiologist, people like surgeon assistant, radiologists, the people who read your X-ray. So these people, they might not be in network. So you don't know that, you just have the relationship with the surgeon. Then you get out network bill from other physician, or you call ambulance. Then you don't know whether the ambulance, maybe the insurance company will cover the ride, but you still have to pay out network for that ambulance service.
It's interesting that you should bring that up because we interviewed a caregiver. She shared her story with us. She has a husband who was having a psychotic break, and so he needed to go. But the thing that she said was, here I am, 40 years old. I never knew that insurance didn't pay for ambulance rides.
Yeah.
And I know that's not top of list in issues for organizations like yours, but I know that you're aware of it being a problem.
Yeah, ambulance services is a big problem for supply billing, right? When you look at all the statistics, the ambulance services and ER services, and also like all the specialist radiology and all that. So these are the big services that you get supply billing the most.
and it's funny because with psychiatry, surprise billing is often not a problem because too often the psychiatrists don't even participate in any insurance.
Right.
And so it's just a matter of you can either afford their price or you can't.
Right. Right. The thing I would add that I think makes the healthcare system particularly difficult for patients is that it makes a certain amount of sense. You walk into especially within the hospital context, you walk into the hospital, you think this is one unit. But the reality is that we're seeing more and more of hospitals that are outsourcing different types of physician practices, emergency room care, OBGYN care, surgical care. And so it's very typical for people to go in for one episode and to receive a bill from the hospital for ER services and some of the hospital services that they might get, and then from other physician groups. And that has an impact that plays into how people get medical bills because some of the protections and things that you can do in terms of hospital care may not apply to the physician group that you're seeing. And it's, I think, difficult for people to understand why it's so complex. Or you wouldn't think that it would be that complex until you're in the situation. And by that time, you've already acquired the bill, you've already acquired the debt, some of your negotiating position is gone because the debt's already been incurred. So, but that is, I think, a common challenge that patients experience, and even patients who know that that is the situation can find themselves, there's just a lot you can't anticipate. So it's not something to feel ashamed about. It's for sure something that I think is impacting many, many people, and it's just not something that, it didn't used to be the case. It didn't used to be this complex. So,
So we're talking about the broader picture of medical debt.
right.
And does that carry a stigma? I mean, are people, is there shame involved in medical debt?
For sure. I think, any kind of debt that is the case. I think one of the things that we used to say about medical debt compared to other forms of debt and some of the work that's been done is to really remind people that unlike making a purchase where you have some decision, buying a new television or a couch or other kinds of consumer goods where people think, well, we're just living beyond our means. That's not the case with medical care, and especially in some of the emergency situations that you're describing. This isn't debt that people want to take on. They don't have a choice, and frequently they're really limited in terms of who's immediately around them. That's even more so in an emergency situation. If you have called 911 or ambulance services, they may not take you to the hospital where you want to be seen or where you have a provider connection. So there's a lot that's not in the control of the patient or of their caregiver, and that I think is really important for us to understand, but also increasingly policymakers have become aware that medical debt, and we started to talk about, should we treat it differently than other kinds of debt. So it's a really widespread problem. About 1 in 6 Americans has a medical account in collections. Over 52% of the accounts in collections are for medical debt. That are not usually for large bills, they're for really small bills as well. So this is a widespread problem up and down the income ladder. There are higher income people who have medical debt. Many low income people have it as well. Obviously it does affect people with lower incomes more than higher incomes, but it's not something that's just an income related issue. And we're starting to see even some of the big credit unions or the credit scoring industry are saying, what we know now from medical debt is it's not a good predictor of whether people want to pay their bills or will pay their bills. And I think that's really kind of an interesting development, that even they recognize if you have medical debt, it doesn't mean that you're financially irresponsible. It means you've gotten caught in this bigger system and not all of it's in your control. So.
Are there ways that people can avoid incurring medical debt? What can they do to avoid surprise billing?
So I can talk about medical debt for a little bit. I think some of it's also situational. So I think if you're fortunate enough to have insurance coverage, you still can do your best to try to find out if now we're talking about non-emergency situations. But looking ahead of time to understand whether the service is covered, at what levels, and what your cost sharing obligations will be. For people who have employer sponsored health insurance, so you get your insurance through your employer, I think especially if you know that you have a family member who's going to need certain kinds of specialty care, one thing that I encourage people to do is to sit down at the beginning of the year when you get to choose, sometimes if you're lucky, when you get to choose your insurance plan, and really try to estimate, are there packages where I would be less on the hook if my family member or if I needed to use some of these other services, and calculate out what those costs will be. Not everybody's in that situation. Not everyone has that flexibility, and sometimes I think one of the challenges is we're seeing more cost sharing being shifted to employees. So that means things like higher deductibles or higher premiums or higher co-insurance, which means you're paying for a certain percentage of the visit. So that's all that aside. Still, the best thing to do is to sit down, as painful as it is, and spend time really cracking those numbers and thinking about what care you're likely to need and whether you can create a cushion. I think once you're in a situation, whether you have insurance or you don't, the other thing that you can always do is talk to the provider. So if you know that you want to see a particular provider, ask them upfront what kind of financial plan they may have. Most hospitals will have some form of financial assistance. Smaller providers may not, but they may have a sliding scale fee option that you could be eligible for. And if you're still worried that you won't be able to pay everything, you can ask to set up a payment plan that's affordable for you and your family. The one thing that I encourage people not to do is to put any kind of medical debt on a credit card, or to avoid any kind of situation where you're turning your medical debt into that kind of credit debt. And you will sometimes see providers encourage patients to do that because it takes care of the bill from their perspective. The challenge is then, to the extent that there are protections against medical debt, you've now opted out of many of them. So as long as the bill is really about an issue between you and the provider, you can usually negotiate something. Once it becomes a credit card debt, now you're talking about interest payments that can balloon up to 23%, and you're now in that stream of credit and collections that doesn't afford you a lot of protection. So those are some of the things that I encourage people to think about as much as they can ahead of time. But it's still not going to solve every problem.
All right, so let's say people do what they can, and yet nonetheless they end up with a bill that they didn't expect. What do they do then? Should they just pay it? That was a setup.
Yeah, so basically you just have to read the bill, right?
Okay.
Just like Jessica said, you have to check every item and to make sure that you understand what the charge is. If you don't, then pick up the phone and talk to insurance company and to ask them, okay, what is it? And they will advise you to basically go back to the provider.
So is this from the explanation of benefits? I mean, that's not a bill. It says it's not a bill, but it is where you find the explanation.
I think sometimes what I recommend is doing both together, because the explanation will come, usually you'll get the explanation of benefits from the insurer first, and then you'll get the provider bill. But I would say, and they should match up, they don't always.
Okay.
And if the bill is higher than what you think, or if the insurance company tells you, you're going to owe this much and you thought the amount was going to be lower, that's a good time to call them and get their side of the story. But I would always ask for an itemized bill from the provider.
From the provider.
That's from the provider. But I found also that, insurance companies, they vary in their responsiveness. I do think there are really good companies out there where you can call and talk to someone and they can walk you through what you can expect. I think like Quincy, I would say get the insurer involved when you can. Sometimes they'll fight a battle for you if the provider is overbilling. And sometimes there are just billing errors. There could have been a coding error that someone in the provider's office put in the wrong code or the wrong date and resulted in a denial. So all of those things are things, if you do have insurance, where you want to put as much of the power of the insurance company behind you as possible. Which really, I think the hard thing for families is it means you have to stay on top of those bills. And that can be really difficult if you're in crisis. You're managing a lot of other things, and that's one more thing to manage. But try as much as you can to stay on top and track, look at the dates of service, get the itemization, and when in doubt, call the insurance company first. And if they give you a certain answer, I'd say then also call the provider. A number of providers also outsource billing and collections. So, you may find yourself, I hate to say it, but you may find yourself on the phone for a while trying to track down some of this information.